In this video, I want to give my impression on CBC's town hall on September 20th titled Situation Critical. In this town hall, they had Minister Adrian Dix and a panel of physicians talk about BC's current healthcare crisis, where 1 in 5 British Columbians do not have access to a family doctor, and that the use of walk-in clinics and urgent care setting is not a sustainable way of delivering healthcare services. They invited listeners to call in to discuss potential healthcare reforms and suggestions on alleviating this healthcare issue. I thought this was a very important discussion to have, and I applaud CBC for bringing this discussion forth. There were some great points that were brought up. For example, there was a suggestion for increasing the collaborative healthcare setting in primary care. For those who don't know, a collaborative healthcare setting is where you have a multidisciplinary team working together to provide care to the patient, with the patient being in the center of care. And this is great because we are able to utilize our multidisciplinary team members to their full potential. However, I was a bit disappointed that the role of pharmacists were not highlighted enough in this town hall. So as a clinical pharmacist working in a hospital setting, I think there are many benefits that a pharmacist can bring to the table and to these collaborative health settings. So a pharmacist's role in the healthcare setting is not just limited to dispensing pills, as what we usually see pharmacists do in the retail setting. So to briefly describe what we do, you can see us as a medication consultant. So as a consultant on medication, we provide advice on use of medications to other healthcare providers like doctors, nurse practitioners, nurses, as well as patients. Pharmacists are readily accessible in the community, and we're qualified to provide medication advices for patients if they have questions about their medications, and to provide monitoring of their medication therapies, especially if they cannot find a family doctor or if there is a long wait time to see their GP. Pharmacists go to school for 6 years, so 2 undergrad with 4 years of pharmacy-specific education to get to where we are today. The pharmacy programs have also evolved drastically over the years, where they're slowly incorporating more clinical component to the pharmacy program in order to empower grads to be able to use physical examination skills to help monitor patients' medication therapies. And after graduating from pharmacy school, many pharmacists also go on to pursue further clinical training, such as in hospital residency and community residency programs. So based on our medication expertise and our current shortage of family physicians, I think pharmacists can play an important role in helping monitor patients' medication therapy after they've been prescribed by family physicians or nurse practitioners. So for example, in a non-collaborative health setting, a patient may be prescribed a blood pressure pill to lower their blood pressure. In this sort of setting, a patient is usually brought back to the clinic after around 1 or 2 weeks to monitor their blood pressure, monitor for side effects, and to adjust the dosage of the medication to target the blood pressure goal they're achieving. However, if we have pharmacists staffed in these multidisciplinary or collaborative healthcare settings, then pharmacists can be utilized to help with the medication monitoring component so that it frees up our family physician and nurse practitioners' time to focus on the more complex patients where their time is better spent. And as pharmacists, we have the legal responsibility through our licensing college to refer patients on to either the family doctor or their nurse practitioners if whatever we're dealing with falls outside of our scope. Along the same lines, for patients who have been stable on their medication therapy, so for example, if they've been on these blood pressure pills for 10 plus years now and their blood pressure has been stable, then pharmacists can also be a healthcare professional that these patients can readily access in their community pharmacies for refills, rather than going back to their family doctors. Refills can be provided to these patients after monitoring their blood pressure, just to make sure that their blood pressure is indeed within target for their medical status. Having pharmacists monitor a patient's medication therapy is not new, as pharmacists already work in collaborative healthcare settings in hospitals, and we do a lot of the medication therapy monitoring, such as adjusting a patient's medication doses for their kidney function and monitoring a medication's serum levels and adjusting their dose to achieve the target levels that we want, as well as monitoring a patient's heart rate to achieve the heart rate control that we want if a medication is prescribed for rate control in atrial fibrillation. As a pharmacist who previously worked in a multidisciplinary clinic setting, we took on most of the warfarin monitoring for our patients, meaning once warfarin, which is a blood thinner, is prescribed for a patient. For those who know this medication, it requires weekly blood work in order for us to get what we call the INR within the target for it to be effective in reducing clots. And so once it's prescribed by the doctors or the nurse practitioner, then they refer these patients over to pharmacy for us to advise patients through weekly phone calls or even 2 times a week phone calls of when to get their blood work and how to adjust their dose based on their blood work results. In addition to this, because warfarin is ridden with medication interactions, we also provide advice on how to adjust their warfarin doses based on new medications that they start and for managing food interactions with warfarin therapy. So as you can see with these weekly or up to thrice weekly phone calls that pharmacists have with these patients on monitoring their medication therapy, it really frees up our colleagues' time, such as our nurse practitioners and our family doctors, to focus on more complex patients and focus their efforts on things that they are trained in, such as being a diagnostician. In addition to helping our colleagues with medication therapy monitoring, pharmacists can also play a role in preventative healthcare. Based on the World Health Organization's report, up to 25% of emergency room visits are due to adverse drug-related reactions. As pharmacists, we know our medications well, and we're able to provide our patients with counseling points on how to avoid side effects when they take medication therapies. So for example, for patients with type 2 diabetes taking diabetes medications, there are some medications that are best for patients to hold when they are sick or if they're at risk of dehydration to prevent kidney injuries as well as lactic acidosis or ketoacidosis during their acute illness. So this is something that a pharmacist can counsel the patients on to prevent these events from happening, which would usually require hospital admission. Pharmacists can also help patients manage their medication interactions to prevent side effects that can result from this. For example, for an antibiotic such as ciprofloxacin, where taking it together with calcium, magnesium supplements, or antacids can reduce its absorption into the body by up to 50%, we could work with the patients to space their concurrent iron supplements and ciprofloxacin apart so that it results in the antibiotic therapy being effective and thus preventing a potential admission to the hospital or another visit to their family doctor if this infection recurs as a result of this interaction. Just to summarize what pharmacists in the primary care setting can bring to the table to help alleviate this issue of a family doctor shortage is that we can help free up our colleagues' time in monitoring medication therapies because we have the qualified training in order to do so. We can also play a role in preventing hospital admissions due to adverse drug effects or side effects from the patient's medication therapies by providing counseling and helping patients manage their drug interactions. However, in order to achieve this, pharmacists require a more expanded scope of practice, which I know many provinces and territories in Canada are slowly working with their colleges and government officials on. In order for a pharmacist to be able to safely and effectively monitor a patient's medication therapies, Pharmacists in the primary care setting and in the retail setting require access to patients' lab results and imaging, diagnostic testings that they do in outpatient labs as well as hospitals. And collaborative health settings that are proposed by some of the listeners in the town hall should routinely include pharmacists for us to have the opportunities to provide our services. We also need to relook at pharmacy funding so that these clinical services provided by pharmacists are fairly compensated for. This is just my impression of what was missing in CBC's Situation Critical Town Hall on September 20th. And I hope that by creating this video, I'm able to slightly increase our public's awareness of what pharmacists do and the importance of our role as medication consultants and not only dispensing medications in our healthcare system, especially in alleviating this family doctor shortage and our current healthcare crisis right now. If you've made it this far, I just want to thank you for watching and for supporting pharmacists' role in the healthcare system.